Hi, Dr. Gulani. I look forward to your surgery, but before we proceed, I would like for you to follow some pre-operative protocols that will increase our chances of success, help you heal well, and get me the best vision I can for you. So, most of you will be traveling to me, so when you do, please make sure I have your most recent eye reports from your eye surgeons who are referring you over, and you can even send them over for our staff and me to review before coming over. Also, make sure you're out of contacts if you wear contacts. If you're into hard contacts, RGP contacts, or scleral contacts, at least 7 to 10 days without contacts. If you're wearing soft contacts, for at least 3 days before. And then, of course, make sure you have a family member with you. If you're traveling to me for surgery, I would like for them to be here with you. And of course, in some cases, if you may need medical clearance from us, you will have a history and physical done with your medical doctor in whatever city, state, country you're coming from. And nowadays also be required to have a COVID test negative before you come over. Make sure these documents and information are reviewed by our staff here who are used to working with this for patients who come here from all over the world to make your journey much more smoother. Then when you arrive in our beautiful Northeast Florida, I'll be measuring you, and I'm known to be extremely strict about that because I'm very intense about the way I see you, design my plan, measure you personally to come up with all my diagnostics and then give you a plan and how I'm proceeding with your surgery. So when you're here, I'll measure you once. I may again want to measure you next day and confirm all my findings before proceeding to surgery. Those 2 days before surgery, you'll be starting your pre-operative eye drops. There'll be 2 bottles. One will be a gray top, which you will use once a day in the eye to be operated, and the other will be a beige top, which is like an antibiotic, which you'll use twice a day in the eye to be operated for the 2 days before surgery. All right? Then when you're here for surgery, the night before, make sure you don't eat or drink after midnight. So those 2 days before surgery, have lots of fun. Go and see the beautiful beaches here and enjoy yourself, because after surgery, I want you absolutely resting in bed, eyes closed, and really boring. Okay? So night before surgery, no eating, drinking after midnight if you can. If you have to take your medication, oral tablets for any reason, you can take them in the morning with a sip of water. And when you're here, please make sure you're dressed comfortably without fleece. Something that'll keep you warm too, because I like to keep the room temperatures cool because of the advanced technologies that require temperature modification. And also, I'm a stickler for no perfume, no deodorant, no makeup, no ornaments. And all these are important because the more intense you get about perfecting vision, the less influence you want of anything that is avoidable. So wash your face thoroughly, and when you come over here, and then we're ready for surgery. From there on, I take over. Me and my amazing Gulani angels will look after you. Look forward to seeing you.